So let us start the general line of treatment for poisoning or therapy and management of poisoning or toxicosis. So in this, we are going to treat the patient, not the poison or toxicant. So this is very important. Here we are only going to discuss about the general line of treatment in case of poisoning. And later on, we are going to discuss separately for toxicity from metals, non-metals, insecticide. But here we are going to discuss about the general line of treatment of poisoning. So when any animals took the poison, first poison will reach to the gastrointestinal tract. So in this, we have to remove the toxicant present in the gastrointestinal tract or stomach or colon. So first is exposure to toxicant, and for that we have to check the absorption of the toxicant or poison once the poison will reach in the gastrointestinal tract. So we have to check the absorption. So once the toxicant or poison get absorbed, it reached in systemic circulation. So once the toxicant reached in systemic circulation, this is going to produce the toxicity and you will find the toxic symptom. So when you will find the toxic symptom, then we have to go through the emergency intervention, or if the things are life threatening symptoms are coming, then we are going to treat the patient according to the symptoms. Then next is third is the antidote. So if we are aware about that, this is the toxicity because of the toxicant, a particular toxicant. When we know about the toxicant, then we are going to give the a particular therapeutic agent, and that we have to call it antidote. So antidotal therapy came. So once the toxicant or poison get absorbed after getting symptoms, antidotal therapy, we have to also think how we have to increase the rate of excretion of the toxicant or poison. So for that, we have to go through the decontamination or hastening or increasing the elimination of absorbed poison or toxicant. So after that, we have to see or monitor the case through which the animal gone through the poisoning. We have to see the particular poison and toxicant produce the damage to which particular organ, or what is the sequel of poisoning. So we have to see the sequel of poisoning in this monitoring the clinical status, as well as we also have to monitor if the toxicant get metabolized within the body of that particular poisoned animal. We have to see whether that metabolized toxicant are more or less toxic. We have to go through that. After that, we have to go through some type of supportive measures, supportive therapy. So we have to go through if there is organ damage, if there is GI problem, then we have to give the special diets or fluids to the poisoned animal. And as well as we have to rule out whether the rate of excretion of the toxicant is slow or fast in that particular poisoned animal. If slow, then we have to increase by giving the drug. Then we have to also train the owners how you have to keep the animal or how you have to monitor the poisoned animal. So this all point we are going to discuss. So first one is the exposure to toxicant. So as I earlier mentioned, if a toxicant reached in gastrointestinal tract, the toxicant is going to start absorbing. So the main motto, we have to check the absorption of toxicant or poison as fast as possible. Because if we are delaying the treatment, then this will going to give rise the more absorption, and if the absorption of the poison occur in more quantity, then the toxicity symptoms are more, and the chances to check the life to save the life of animal become difficult. So first we have to check the absorption of toxicant from the GI tract. So how we have to check the absorption, that is coming under the first point, that is the exposure to toxicant or preventing the absorption of the toxicant from the GI tract. So for that, we have to first go through the protocol emesis. We have to use the drug that will produce the vomission. So the because of the vomission, the content present in the gastrointestinal tract should be removed. So then in the next stage, if the emesis is not to be performed in the poisoned animal, and in some cases of the animal, then we have to go through the second protocol of treatment in this to check the absorption of toxicant is gastric lavage. So lavage is simply washing out the gastrointestinal tract. So we have to wash out the gastrointestinal tract by warm or tepid water. And if after these two protocol, we have to now think that even after going through these two process, the some amount of the toxicant is still present in the GI tract, then we are going to give the drug that absorb the toxicant. So that is why we have to go through the adsorption therapy. And simultaneously we have to go through the purgative or cathartic. So through the adsorption, the toxicant is going to be adsorbed, and that should be removed out by giving the purgative or cathartics. And also we have to simultaneously run the enema. So enema is a process by which we are going to give the liquid soap solution through the rectal route to wash out. So then we have to go through the then we have to rule out the other body part where the toxicant may present by cleaning the skin, by cleaning the hair. We also have to rule out the presence of poison over the eyes, so cleaning of eyes. Even though if you are thinking these all are failed, then we have to go through the gastrotomy or immunotomy. If we will find some toxicant are still there, then we have to go through that. And by these all protocol, we are going to remove the toxicant from the gastrointestinal tract, and therefore the chances of toxicity get reduced, because if the toxicant is no more in the GI tract, then how this is going to produce the toxicity? So we have to reduce the amount of toxicant present in the GI tract by these processes. So we have to go through the one by one. In this we also have to tell to the owner that you have to keep the animal away from the pasture that you are giving to the animal, away from the feed and fodder that and water you are giving to the animal. Then you have to so that you have to rule out whether the toxicant may be present in the pasture or feed or water, and you have to give a fresh of these all feeding material. Thereafter, you have to be cautious. You have to treat or prevent the absorption of the toxicant as fast as possible, at least within 2 hours of the ingestion of the toxicant. So this is very, very important. So first, what we have to give under this, the prevention of absorption of toxicant, is emesis. So what is emesis? Emesis is a process by which we are going to induce the vomison to the poisoned animal, and therefore it will remove the toxicant present in the GI tract. So this, by this process, about 80% of the ingested toxicant has to be removed from the GI tract. And under this, the emetics that we are using, and the most important, are ipecac syrup or ipecacuanha solution, this is also called. And for dog and cat, the ipecac syrup and ipecacuanha solution at the dose rate of 2 and 3 ml per kg body weight respectively. Means for dog 2 ml per kg body weight, for cat 3 ml per kg body weight we have to give. So this is important one, and this is rather safer than the sodium chloride and copper sulfate solution. These two are usually present in homes. Sodium chloride means salt. So generally, to induce the vomison to the poisoned animal, we have to give the saturated solution of the sodium chloride solution to the poisoned animal to produce the emesis, but this is sometimes produce toxicity also because of the salt or because of the copper sulfate solution. So it is better to use the drug like ipecac syrup or ipecacuanha. Other than that, we have to use hydrogen peroxide solution 3%. So 3% solution of the hydrogen peroxide we have to use to treat the to induce the vomison in the dog at the dose rate of 2 to 5 ml per kg body weight, and it should not be the total amount or total volume of this hydrogen peroxide. 3% should not exceed 40 to 50 ml of total dose, and this should be careful. Then if if you will not found either ipecac, either sodium chloride, or either copper sulfate, then you have to also use the liquid dishwash detergent. By this, this will also helps to induce the emesis or vomison. So this may be one of the emetics that we have to use if there is unavailability of these uh, treat, treatment these agent. Then for veterinary purposes, these other drugs that are very, very important and should be used in case of veterinary purposes are apomorphine and xylazine. So apomorphine we have to use for producing vomison to induce the emesis in dog, and we are going to give the apomorphine at the dose rate of 0.04 mg per kg IV or IM solution. And if you will find the toxicity because of this apomorphine, because this is somewhat the mechanism of action of morphine, apomorphine is quite related to the opioids. So if the opioid type of toxicity occur because of this apomorphine, then because of excessive dose of the apomorphine, then we have to use or antagonize the action of apomorphine by giving the apomorphine antagonist, that is the naloxone. So what is naloxone? Naloxone is a apomorphine antagonist, and because the apomorphine mechanism is quite related or similar to the opioid, so therefore it blocks the action of apomorphine to act on the opioid receptor. Which one? The naloxone. So naloxone is not only apomorphine antagonist, but also naloxone is opioids antagonist, or it inhibits the action of opioids on opioid receptors. Next to apomorphine is xylazine. So xylazine is specifically used as a emetic in cats, and the dose therapeutic dose of xylazine in a species cat is 1.1 mg per kg body weight, and side effect of the xylazine in cat species is respiratory depression, as we have seen with the apomorphine. Also apomorphine toxicity is also going to depress the CNS or respiratory depression. So in case of xylazine toxicity, we have to give the its it drug which inhibit the action of xylazine. So yohimbine is a antagonist, is a drug which have to be given for the therapy of xylazine toxicity, which produces respiratory depression in cat at higher dose, because yohimbine is a alpha 2 adrenergic receptor antagonist and xylazine is a agonist. So antagonist we have given the yohimbine to inhibit the agonist activity, that is the xylazine activity. So this is all about the emetics that we are using for the in poisoned animal like dog and cats, and the drugs are important drugs are ipecac, then hydrogen peroxide, then apomorphine, then xylazine, and the dose are also written here. Now we have to go through the condition where we are not going to prescribe the emetics to produce the momission. What these conditions and or the species are: we are not going to give the emetics in rodents, rabbit, horses, ruminants, because these all species are usually not able to vomit, and therefore we are not going to give the emetics in these species. As well as we are not going to give emetic in unconscious animal, or if the animal is depressed, very depressed. Why? Because when you are going to give the emetics in these unconscious very depressed animal, then there may be chances, because of the vomission, the material will come in the respiratory passages, and the animal will die not because of the poisoning, die because of respiratory failure, as the vomitus come in the respiratory tract. Then we have to also not give the emetics in if the animal is seizuring. Also we have to not give the emetics if the toxic material or poison or toxicant is corrosive in nature or caustic in nature, then we can't prefer to give the emetics. Why? Because when you are giving the emetics in toxicant like corrosive and caustic, then what will happen? These corrosive material through vomit, it will come also to the mouth, and it will also corrode or it produce the caustic of whole GI tract up to the mouth. So therefore we are not going to give the emetics in those poisoned animal poisoned by the corrosive substances or caustic substances. Also we don't have to give in case of petroleum distillate. So in these all condition, and other than these condition where we are not able to give the emetics to remove the poison from the gastrointestinal tract, then we have to go through the gastric lavage. The another option of the therapy to remove the toxicant or poison from the GI tract is the gastric lavage. So lavage is nothing. Lavage is simply the washing out body cavity such as colon or stomach. So washing out body cavity such as colon or stomach is called lavage. In this lavage we are using the tepid water, lukewarm water. So lukewarm water has to reach in the colon or stomach, and through the tube we have to wash out. That is similar to the vomison. Through the tube we have to take out the content from the GI tract, that is the colon or stomach. So we have to use the lavage, gastric lavage, where the emetics are ineffective or contraindicated. And we have to use if the animal are unconscious or anesthetized. So for that, we have to also give the endotracheal tube. Before going to give the gastric lavage, you have to give the endotracheal tube so that the possibility of aspiration of the content present in the GI tract in the respiratory tract should be avoided. So we have to give simultaneously with the gastric lavage tube, we have to also give the endotracheal tube to check the aspiration of content in the respiratory passage. Lavage are simply the fluid, that is the tepid water or warm water or saline. We have to administer gently, slowly by gravity flow of 10 ml per kg body weight, and as I have mentioned, warm or tepid fluid, and by washing the GI tract we have to take out the fluid by sucking and remove the content present in the GI tract, that is gastric emptying. So this we have to perform about 15 to 25 times so that all the content present in the gastrointestinal tract should be removed by the process we call is the gastric lavage. Simultaneously, along with the enterogastric lavage, we have to go through the retrograde a high enema. What is this retrograde enema? Retrograde enema is that we are not only to wash out through introgastric lavage, we have through mouth, we have to also remove through the rectal route. So how we have to go through that? Through rectal route, we have to pass out a tube through the rectum up to the colon, and we have to give the soapy solution, and therefore through soapy solution through the tube, the content present in the colon should be removed out through the rectal route, and this is called enema. Enema is a process by which we are passing out the soapy solution in the colon by passing out a tube through rectal route, and again we are sucking the things present in the colon by gravity flow, and this will remove through the rectal route. So by this means we are not only going to remove through the mouth, but we are also through remove by through the rectal route by giving the enema. So the chances of the presence of toxicant in gastrointestinal tract should be erased. And if after this gastric lavage, if even though if you are thinking some amount of the toxicant is still in the GI tract, then we have to proceed by other process to remove the toxicant present in the GI tract by giving the adsorbents. So this is called adsorption therapy. So adsorbent like activated charcoal. So what is activated charcoal? Is act at adsorbent, and the adsorbent is adsorbing the material from the surrounding. So when you are giving the activated charcoal through oral route by means of water slurry in activated charcoal, we have to give in the water, and then we have to give to the poisoned animal by oral route. So we are going to give activated charcoal, and this activated charcoal in form of water slurry at the dose rate of 2 to 5 gram per kg body weight we have to give to the poisoned animal, and this activated charcoal is going to absorb the toxic material present in the GI tract, and thereafter if these all toxic substance of poison get absorbed in the activated charcoal, we have to remove the activated charcoal from the GI tract by giving the purgative or cathartics. So always adsorption therapy is simultaneously run along with the cathartic or purgative, because when you are absorbing the poison or toxicant, you have to remove this also from the GI tract. For that you have to give the purgative or cathartic, so that is we are giving the cathartic. So activated charcoal is usually ineffective in ammonia and cyanide toxicity, and this activated charcoal should be followed where the emesis or gastric lavage or other process of the removing of content from the GI tract is get failed or contraindicated. Then there is more choice. You have to give the adsorption therapy in absentia of emesis or gastric lavage therapy, or if these other process of removal of the item from the GI tract is failed, in that case you have to go through the adsorption therapy. So as I earlier mentioned, the activated charcoal usually administered with the purgative or cathartics, and cathartic or purgative that we are using are sodium sulfate or sorbitol. Sodium sulfate is simply a purgative, and the dose rate is 250 mg per kg body weight, and we have to administer orally. And for sorbitol, the solution should be 70%, and the dose rate is 3 ml per kg body weight orally. And because the sorbitol is a osmotic in nature, and because of its osmotic nature, they absorb the water from the surrounding, and it give the bulkiness to the stomach and enhance the peristaltic movement to remove the content for present in the GI tract. Other than these are other adsorbent are that are commonly available in the house are milk, white eggs, and other demulcent we have to give. So under the adsorption therapy we have to give the activated charcoal, but this activated charcoal is ineffective in the poisoning because of ammonia and cyanide. Even you are thinking that the foreign body or toxicant material is still persisted in the GI tract, like tars, toxic oil, then you have to go through the gastrotomy or immunotomy. And other are simple. This is all about the way. The first one, the A, is you have to go through the emergency intervention. In that you have to go through the first one, that is the exposure to the toxicant, and you have to remove the toxicant present in the GI tract. Second, we have to go through the emergency intervention. So what is this emergency intervention? Emergency intervention means if the poisoned animal came in your hospital for the therapy after 2 hours or get delayed, then that means ki toxicant or poison get absorbed, and you are, as a clinician, you will find the symptom, toxic symptom. So in that case Therefore, you have to, no doubt, you have to go through the first process of emetics, giving gastric lavage, giving adsorption therapy. But if you are thinking it is quite delayed, an animal came delayed, then you have to simultaneously run the symptomatic or supportive treatment. And if the symptoms are life threatening, then you have to check the symptoms by giving the particular drug as per the symptom. So what the symptom coming as a major life threatening effect in poisoned animal are respiratory depression or respiratory failure. So if you find if the animal is suffering or going through the respiratory depression or respiratory failure, then you have to go through the ventilation or oxygen supply to the poisoned animal. And simultaneously you have to give the respiratory or CNS stimulant. Respiratory stimulant is also called analeptics, and the drugs doxapram is a respiratory stimulant. So you have to give the respiratory stimulant in poisoned animal in which you are getting the symptom of respiratory depression, and the dose of doxapram is 1 to 10 mg per kg IV. And if you are finding in dog the respiratory depression because of opioid exposure, so as you know, opioids are acting on the opioid receptor to produce the respiratory depression. So you have to use the drug as an antidote or as a symptomatic treatment that is going to check the attachment of opioid on the opioid receptor by giving the antagonist of opioid. So the antagonist is the naloxone. So naloxone is going to check the attachment of opioid on opioid receptor as an antagonist, and the dose in case of dog is 0.04 mg per kg IV or IM or subcut. If you are finding the symptom other than respiratory related symptom or cardiac arrhythmia. What is the meaning of cardiac arrhythmia? Heart is not in rhythm, and this you will find this symptom in case of poisoned animal poisoned by organophosphorus insecticide, carbamates, and others are like digitalis. So if the poisoned animal symptoms are cardiac arrhythmia, suffering from cardiac arrhythmia, that is the heart is not in rhythm, and symptom may be because of one of these toxicant like organophosphorus insecticide, carbamate, carbamates insecticide, digitalis, then you have to give the atropine. So what is this atropine? Is a muscarinic antagonist. So you have to give this muscarinic antagonist atropine at the dose rate of 0.01 to 0.2 mg per kg body weight IV or IM. If you will find the symptoms like that is related to central nervous system, that is the seizure. If the seizure, this is the incoordination movement of the body and muscular twitching, then you have to keep the animal calm and quiet by giving the sedatives. And for the sedatives to remove the seizures, then you have to give the sedatives like diazepam or phenobarbital or pentobarbital. So diazepam is a benzodiazepine. However, phenobarbital and pentobarbital are barbiturates, and these benzodiazepine and barbiturate are sedative in action, and it will keep the animal calm and quiet, and it remove the symptoms seizures. Then you have to give the respiratory. If there is again here the same point, if there is the respiratory depression or CNS depression, so respiratory depression you have to give the analeptics like drug CNS that we have already mentioned earlier. And we also discuss about the naloxone if there is the toxicity of the opioid toxicity. So this opioid toxicity, you have to go give the drug like naloxone. Now, the other antagonists that we are going to use are, if you are thinking the toxicant is acidic in nature, then you have to give the alkalizer. If you are getting the symptoms like hyperthermia, means कि poisoned animal temperature, body temperature is high, then you have to give the cold bath, ice pack, or by any means you are going to keep the animal cool. So in case of hyperthermia, you have to give these treatment, and in case of hypothermia, you have to give the blanket to the animal, or warm water in bottle, or heating pad to the animal. So this is the general way of treatment as per the symptom you are getting. Now we have to go through the antidotal therapy. This earlier that we are mentioned in this case, that we have treated by as per the symptom. If there is CNS depression, if there is cardiac arrhythmia, if there is seizures, if there is the opioid toxicity, so in these case, by looking the symptom, we have given the treatment. But if you got that the toxicity because of this particular toxicant, then you try to give a particular drug that is used for the treatment of that particular poison or that particular toxicant, that is called antidotes. So antidotes are the agent that we are going to give to the poisoned animal for that particular toxicant, is called antidotal therapy. Take the example one by one. What are the, and these that we are going to discuss are very important, because separately we are going to discuss the same thing when we are going to discuss separately a particular toxicant, means metal. So we have to go through the particular metal therapy, and here we are going to discuss these all are coming together. Take the first example is acetaminophen. So what is this acetaminophen? Acetaminophen is a paracetamol. So paracetamol is a hepatotoxic agent if the dose of paracetamol become high, and the toxic metabolite formed from the paracetamol or acetaminophen is called NAPK. So NAPK is a toxic metabolite formed from the acetaminophen, and this NAPK is a hepatotoxic and going to produce the liver toxicity. And this is only because of the deficiency of antioxidant natural body compound glutathione. So if the glutathione level in poisoned animal is low, that is poisoned with the acetaminophen, then if the glutathione is low, then the NAPK is going to produce the hepatotoxicity. So we are going to give those drug as a therapeutic agent because of the toxicity of paracetamol or acetaminophen, that is going to give or provide the compound which helps to rise the antioxidant compound glutathione. So N-acetylcysteine is an agent which are usually giving we usually going to enhance the concentration of glutathione. So as N-acetylcysteine, we are going to treat as a antidotal therapy for paracetamol toxicity, and the dose is 140 mg per kg. And if you are going to give the divided dose, then the dose for the N-acetylcysteine is 70 mg per kg body weight 6 hourly. And usually N-acetylcysteine is not going to give along with oxidizing agent, amphotericin B, ampicillin, tetracycline, erythromycin, H2O2, because with these all agent that I have mentioned, N-acetylcysteine is incompatible, means ki not good to use along with this, and therefore we are not going to give along with these agents that we have cited. So what is the mechanism of this N-acetylcysteine? N-acetylcysteine is going to supply the material, precursor material to the glutathione, and this glutathione is a antioxidant property, and that is going to metabolize the NAPK, and therefore reduces the toxicity from the NAPK. So glutathione is going to be raised when you are going to give the agent N-acetylcysteine. Now we have to go through the toxicity because of the organophosphorus insecticide toxicity or carbamate toxicity. So these two insecticide are mechanism of toxicity of these two are they are going to inhibit the enzyme acetylcholinesterase. So what is the mechanism of toxicity of these two? They are going to inhibit the enzyme acetylcholinesterase, and therefore these are called anticholinesterase. So once the enzyme acetylcholinesterase get inhibited, the acetylcholine is not going to be break down. So if the acetylcholine is not going to be break down because of this toxicity, acetylcholine function, physiological function persisted within the body for longer time interval, and therefore it produces the toxicity. And the symptom related to the opioids or carbamate toxicity is a dumbbell that we are earlier also discussed, and the therapy for that is atropine. So atropine is again muscarinic antagonist, and this atropine we are using to bond with the muscarinic receptor. Therefore, acetylcholine neurotransmitter is unable to bind with the receptor and not going to produce the toxic symptom like dumbbell, Dumbells, like that. Spelling is like that. Then the toxicity because of the antifreeze agent ethylene glycol. Ethylene glycol is a antifreeze agent, and the toxicity because of the toxicity of this, we are going to treat the toxicity of ethylene glycol with the drug like ethanol or 4-methyl pyrazole. So ethanol and 4-methyl pyrazole are the antidote for ethylene glycol, whereas for organophosphorus and carbamate antidote is atropine sulfate, whereas the antidote for acetaminophen or paracetamol is N-acetylcysteine. So for ethylene glycol, we have to give the ethanol as a therapeutic agent, and the solution percentage is 20% at the dose rate of 5.5 ml per kg every 4 hourly intravenously, and 4-methyl pyrazole is dose is 20 mg per kg IV, but this 4-methyl pyrazole is not recommended for the cat. So these two are the antidote for the antifreeze agent ethylene glycol. And what these two are going to do, they are going to compete with the enzyme alcohol dehydrogenase and inhibit the formation of toxic intermediate. What it means, ethylene glycol in presence of enzyme alcohol dehydrogenase that found within the body is going to form the toxic metabolites or toxic acidic intermediate within the body. So these two drugs, ethanol 20% and 4-methyl pyrazole, is going to compete with alcohol dehydrogenation. So therefore, it inhibits the action of alcohol dehydrogenate to produce the toxic intermediate of ethylene glycol. Now we have to go through the metal toxicity because of the arsenic. Arsenic is a metal, produce the metal, heavy metal, and produce the toxicity, arsenic toxicity. Arsenic is also called levisite. Levisite is organoarsenic compound. So, in case of arsenic toxicity, as a antidote for arsenic, we are using dimercaprol. Dimercaprol is also known as ball. So, if you are forgetting the antidote for arsenic, you have to recall the ball. Ball means British anti-leviside, and ball is itself indicating this is an antidote for arsenic, means leviside. So easy to recall, and the dose rate is 3 mg per kg intravenously. Ball we have to administer, and the other name of ball is dimercaprol. So ball is usually used, or dimercaprol is usually used for the arsenic or other heavy metal toxicity like mercury, like antimony, like lead, and other more heavy metal toxicity. Along with dimercaprol, we may give as a antidote of arsenic toxicity is DL6 8 octic acid at the dose rate of 50 mg per kg intramuscular. So this is about the antidote for the arsenic. Now we have to go through the antidote for the copper toxicity. Copper toxicity is a copper is a hepatotoxic agent, mainly the hepatotoxic. Usually copper is at normal condition is not going to produce any toxicity, but if the copper is going to be took in high concentration, this is going to produce the toxicity. And copper in some case of the genetic diseases that is found in the human being is called Wilson disease. So Wilson disease patient that is a genetic disease in human being, they have the property to accumulate the copper in the liver similar to the sheep. Means ki Wilson disease patient as well as the sheep in case of animal is showing the property to accumulate the copper in the liver. And when the heavy quantity of liver accumulated the copper, it will produces the sudden release of copper from the liver, and because of sudden release of copper from the liver, it will damage the hepatocyte organelles and therefore produce the hepatotoxicity. Not only that, the copper when reach in the systemic circulation is very high concentration, it also oxidizes the erythrocyte. Which one? Copper. So copper is going to oxidize the erythrocyte, and the erythrocyte become fragile. So by this means the copper is going to produce this toxicity in the patient that are suffering from Wilson disease, and the sheep that are having the property to accumulate the copper in the liver. And for the therapeutic agent, we are using the two main agent, that is the ascorbic acid, dipenicillamine, and ammonium molybdate, and ammonium tetrathiomolybdate. So we have to go one by one. Ascorbic acid in treatment of copper toxicity for dog, the dose is 500 to 1000 milligram daily orally. Why this is going to produce the antidote for copper toxicity? How? This ascorbic acid is going to enhance the rate of excretion of copper. So rate of excretion of copper get increased. That means copper is going to remove fastly from the body of poisoned animal. Not only that, this ascorbic acid is also going to reduce the copper absorption from the GI tract. So not only increases the rate of excretion of copper, ascorbic acid also prevent the oral absorption of the copper from the GI tract. Along with that, we are using dipenicillamine. And for the SIP, we are going to use the ammonium molybdenate orally at the dose rate of 200 mg per kg body weight. And also we are using ammonium tetrathiomolybdenate in acute copper toxicity in sheep at the dose rate of 1.7 to 3.4 mg per kg IV, which both are able to promote the excretion of copper from the body of poisoned animal. So other than that, now we have to go through the other toxicity. If the toxicity because of the anticoagulant like coumarin and indindione or warfarin. So warfarin, coumarin, indindione, these all are the these all are the vitamin K antagonist. These all are the vitamin K antagonists. So we are going to give the drug which enhance the production of vitamin K1 or vitamin K. So coumarin and Indian ion or warfarin is going to use as an anticoagulant by inhibiting the vitamin K synthesis. So we have to use its antidote to synthesize the vitamin K by giving the vitamin K, that is the phytonadione. Now we have to go other toxicant, very important toxicant is the cyanide toxicant. This is found in the plant. So cyanide toxicity you have to see in the field condition. Cyanide is coming from the plant source. So cyanide toxicity, the cyanide is the mechanism of toxicity of cyanide is that cyanide is going to inhibit the molecular respiration. Molecular, it check the cyanide is inhibiting the molecular respiration or intracellular respiration by inhibiting one enzyme, respiratory enzyme, cytochrome C oxidase. So mechanism of toxicity of cyanide is by inhibiting the enzyme cytochrome C oxidase. This is a mitochondrial enzyme participated in the molecular respiration, and this molecular respiration get inhibited, and this cyanide is going to inhibit the ATP synthesis by inhibiting this cytochrome C oxidase. The cytochrome C oxidase is finally participating in ATP generation. So therefore, as an antidote of cyanide toxicity, we are going to use sodium nitrite and sodium thiosulfate at the dose rate of 22 mg per kg intravenously and 60 mg per kg intravenously respectively. But you have to get it in mind that if you are going to increase the dose of nitrite in cyanide poisoned animal, sodium nitrite itself is a poisoning, going to produce the poisoning. So therefore we have to give sodium nitrate slowly and cautiously in cyanide poisoned animal as a cyanide antidote. And also the second drug is the sodium thiosulfate. So this is about the cyanide toxicity. Now we have to go through the another metal toxicity is the lead toxicity. So in lead toxicity, what is the mechanism of toxicity of the lead? Lead is going to inhibit many important enzyme of the physiological function that the lead are going to produce the toxicity. So toxicity because of the lead inhibit the enzyme like super catalase enzyme, SOD enzyme, glutathione peroxidase enzyme, glutathione 6 phosphate dehydrogenase enzyme, and GSH. glutathione, GSS. These enzyme is going to be inhibited by, and not only that, lead is also inhibiting the enzyme that are participating in the hemoglobin or heme synthesis. So because the lead is going to be inhibiting this much of enzyme, therefore lead is usually producing the symptom related to most of the important system of the body, like the heme. If this is going to inhibit the enzyme participated in the heme synthesis, then how the heme synthesis will occur? If this is going to inhibit the antioxidant enzyme like SOD, CAT, and GPX, so antioxidant property animal get lost. So therefore, as a antidote of lead toxicity, we are going to give the drug like chelator. Chelator means ki those agent which bind to the toxicant or poison and going to be removed from the body is called chelator. Means the chelator for this lead or zinc or other metals is calcium disodium EDTA. Not only EDTA, calcium disodium EDTA as a antidote, as a chelating agent for lead toxicity, and this is having the property, I mean calcium disodium EDTA having property to bind with the lead. So this is going to bind with the lead and going to be removed from the body of poisoned animal. And this one calcium disodium EDTA is not only used for lead toxicity but also used for the zinc toxicity. And dose is 110 mg per kg per day IV as a initial dose, followed by subcut dose. Then deep penicillamine we have to also use for the therapy of this one, because deep penicillamine is a antidote which possesses the thiol group in the structure, that is the SS group, and various toxic heavy metal are possessing property to bind with the sulfhydryl group. So you are giving the drug as an antidote where the sulfhydryl group is present. So the toxic agent is going to bind with the structure thiol that is present in the deep penicillamine, that is the SH, and therefore it removes the lead or other metal like zinc from the poisoned animal. Now we have to go through the methemoglobinemia in cat. So what is methemoglobinemia? Methemoglobinemia is a condition where the iron is converted into the ick form from +2 to +3. So +3, yes, +3 form of the hemoglobin is called methemoglobin form. So +3 form of the hemoglobin do not possess property to carry the oxygen to the cell for the cellular respiration. So therefore it inhibits the cellular respiration. Why? Because the hemoglobin, the iron present in the hemoglobin, like methemoglobin, don't have the property to carry the oxygen. So no oxygen to the soul, to the cell. Therefore, toxic effect, no respiration, cellular respiration. So toxic effect is going to produce. So as an antidote for methemoglobinemia, particularly for the cat, we are using the ascorbic acid. Ascorbic acid as a therapeutic agent or antidote for methemoglobinemia is in cat. Why? Because this one is a reducing agent. Ascorbic acid acts as a reducing agent, and the reducing agent are usually helps to convert +3 iron to +2 iron. Means methemoglobin converted into hemoglobin form to carry the oxygen. Now we have to go through the nitrate and nitrite or chlorate toxicity. So if a plant is possessing high amount of nitrate and nitrite in the plant, then the toxicity is more to the animal which is eating the pasture containing high amount of the nitrate and nitrite or chlorate. So as I earlier mentioned, nitrate and nitrite itself or chlorate itself is going to form the toxicity, because this nitrite, sodium nitrite, is used as a therapeutic agent for cyanide toxicity, or when there is nitrite toxicity, as an antidote we are using the methylene blue, particularly leucomethylene blue, because this is the reduced form of methylene blue. So nitrate, nitrite and chlorate toxicity we have to treat with the leucomethylene blue. What is leucomethylene blue? This is the reduced form of the methylene blue, having the property to convert the +3 iron to +2 iron, and therefore the methemoglobin converted into hemoglobin, and therefore now the hemoglobin is having the property to carry the oxygen and supply to the all the cell within the body. Next we have to go through the toxicant like organophosphorus insecticide. Organophosphorus insecticide. So organophosphorus insecticide, we have earlier mentioned that organophosphorus insecticide is a anticholinesterase. What it means? This organophosphorus insecticide is the insecticide having the property to produce the toxicity by binding with the physiological enzyme. We call it acetylcholinesterase. And because of the unavailability of the acetylcholinesterase within the body of animal, the acetylcholine is not going to be break down, and acetylcholine is going to produce its action on muscarinic and other respective receptor, and therefore its action get prolonged. Which one? The acetylcholine, and you will find the symptom. If the acetylcholine action is prolonged on muscarinic receptor, you will find the toxic symptom correlated with the dumbbell, and you have to give the first drug that which generate the enzyme, that is the acetylcholinesterase. So 2-palm or prelidoxime, 2-palm chloride and prelidoxime chloride are the same. They are acetylcholinesterase enzyme reactivator. Therefore, we are going to use as a antidote for organophosphorus insecticide. Simultaneously, because the acetylcholine is going to produce the symptoms, toxic symptom by binding with the muscarinic receptor, we have to treat this organophosphorus insecticide toxicity by the giving the drug not only 2-palm, but also we are going to give the muscarinic antagonist atropine. So the next one, the snake bite. For a snake bite treatment, we have to give the antivenin. Antivenin means just just like antibody against a particular toxin or particular venom is called antivenom, and we have to administer one vial slowly through intravenous route. Zinc toxicity antidote that we already mentioned, for the zinc and lead antidotal therapy is calcium disodium EDTA. We also discuss about toxicity, about opioid toxicity, naloxone as an antidote, because opioid is acting on the opioid receptor and naloxone is also acting on the opioid receptor. So when in presence of opioid you are giving the naloxone, the binding of naloxone to the opioid receptor, Therefore, the opioid is not possessing its toxic, not showing the toxic symptom because the very meager quantity of opioids is binding with the receptor, opioid receptor to produce the toxicity because that is acquired by the antidote naloxone. So next is the uh, iron toxicity that usually you have to see in the kid because of its color. Iron tablet is coming in the red color or coloring in the form of color. So the children are usually take it eaten by the kids because of the color attracting it, and therefore it produces the toxicity not only in the human being kids but also in the animal, particularly the pet animal, and therefore it produces the iron toxicity. So to check the iron toxicity, we have to give the agent or drug as an antidote which bind with the iron is desferoxamine. So desferoxamine is a drug, is a antidote for iron because deferoxamine is going to bind with the iron, also aluminum, to remove out it from the body, and therefore it is used as a antidote for the iron toxicity. Now we have to go through the sedative benzodiazepine that we have already earlier mentioned. So what is this benzodiazepine? Benzodiazepine is under the drugs are diazepam. So mechanism of toxicity of benzodiazepines. Benzodiazepines are going to enhance the action of inhibitory neurotransmitter GABA by binding with a GABA A receptor. Again, I am going to repeat the same thing. Benzodiazepines like diazepam acting on the GABA A receptor, and therefore it prolong the action of GABA to act on the chloride channel, and therefore inhibitory type of activity occur in the poisoned animal. Inhibitory means if the benzodiazepines poisoning occur, then excitatory effect get nullified, get finished. Only inhibitory effect comes. So the patient gets slept, patient go in coma, and for treatment of this benzodiazepine we have to use as an antidote. The drug is flumazenil. So flumazenil is a GABA A receptor antagonist. So therefore benzodiazepine is not able to bind with the GABA A receptor because the GABA A receptor get occupied by antagonist flumazenil, and therefore benzodiazepine effect get antagonized by flumazenil. Now we have to go through the toxicant like a poison like arsenic and arsenic and antimony. For that, again, the D-penicillamine as an antidote we have to use that I earlier mentioned. The most of the heavy metal like arsenic, like antimatter, like lead, like mercury, these all heavy metal are having the property to bind with the thiol group present in the body. So if the thiol group present in the physiological chemical, physiological enzyme, then this is going to bind with the thiol group. So as a antagonist, we are going to give the D-penicillamine, and D-penicillamine is going to provide the thiol group because the thiol group present in this structure, and therefore the arsenic toxic agent, arsenic or antimony or lead or mercury is going to bind with the thiol group and going to leave the natural physiological enzyme, and that it should be removed from the body. This by this means that antagonizes the activity of poisoning because of arsenic, antimony, lead, mercury. Next is the Now we have to enhance the excretion of the toxicant. Poison, toxicant, excretion of the toxicant or poison, excretion of the poison. How we have to enhance the excretion? By increasing the metabolism, by increasing the urinary diuresis, by passing out urine, by neutralizing the toxic agent, by increasing the rate of metabolism of the toxicant. So by these all means, we are going to enhance the elimination of the toxicant, and we have to discuss one by one. How? When you are giving any drug as a diuretic, so diuretic is going to increase the rate of excretion by enhancing the urine flow. So urine, as you know, within the urine, the toxicant or poison is going to be excreted out. So when the rate of uresis, diuresis is fast, or then rate of excretion of toxicant is also fast. So what we are only doing, we are going to increase the passing out of urine by giving the diuretics. So the drug, osmotic drug like mannitol is a diuretic. Also furosemide is also a diuretic. This furosemide is acting through the inhibition of sodium potassium chloride symport, and mannitol is simply osmotic diuretic. By its osmotic property in the lumen of the Bowman capsule, it absorbs the water from the surrounding and increases the volume of urine and pass out it. So this is one, by increasing the diuresis. Second one, if you are varying the chemical nature of the toxicant, you have to nullify the activity by giving the just opposite nature of the compound. What it means, if the nature of the drug is toxicant is acidic, then you have to give a drug as a basic. If the nature of toxicant is the basic, you have to give the acidic drug, because they are going to neutralize the action of the toxicant. So we are simply the neutralizing the action of the toxicant by giving the drug which is physically opposite of the toxicant. Like if the toxicant is acidic in nature, like acetaminophen, barbiturate, phenoxyherbicide, then you have to give the alkalizer like soda bicarb. If the basic drug or toxicant like amphetamine or most alkaloid, these all are basic in nature, you have to give the acidifier sodium chloride. So they are only chemically neutralizing the poison or toxicant, and it nullifying the activity of poisoning. Not only chemical neutralization occur, but it also ionizing the toxicant. So as you know, the ionized agent are easily removed from the body. Now these, then you have to go through adsorption therapy like activated charcoal. Then you have to go through peritoneal dialysis so that it should be removed from the peritoneum. Then you have to, the most important are three only. This one, number one, number two, and number five. And number four and number five. In number five, only increasing the or fastening or slowing the action of metabolizing hepatic microsomal enzyme. So what is the function of hepatic microsomal enzyme? These, when you are enhancing the activity of or inhibiting the activity of these enzyme, accordingly the metabolization of toxicant are either slowed or fast, and therefore it excreted out slow or fast accordingly. Take the example of a stimulator. So, microsomal enzyme stimulator are rifampicin or rifampin, anticonvulsant drug like phenobarbital, phenytoin, carbamazepine. These all are microsomal enzyme stimulator. So what will happen when this microsomal enzyme get stimulated? Because of that stimulated, it increases the rate of metabolism of these agents like phenobarbital, phenytoin, and carbamazine. However, some of the drug which inhibit the metabolization of the agent, poison, toxicant, is called microsomal enzyme inhibitor, and the example are ketoconazole, cimetidine, erythromycin, chloramphenicol.